Hello and welcome. My name is Carolina Dominguez.
And I'm Nuala Coady. We represent the Dublin South and Wicklow Integrated Healthcare Area, and we're here today to talk to you about breast cancer awareness.
We work as a health promotion and improvement officers, so our goal is to help you understand how to stay healthy, reduce the risk of breast cancer, recognize the signs, and be breast aware. So what's breast cancer?
Breast cancer occurs when the cells of the breast change. Instead of functioning normally, they begin to grow in an abnormal way.
Over time, a group of these abnormal cancer cells can gather together to form a tumor, or might present as a rash or other signs. 1 in 7 women in Ireland will develop breast cancer in their lifetime. It is most common in women over 50 years of age, but it can happen in younger women too. Breast cancer is the most common invasive cancer in women, accounting for 30% of all female cancers.
Our goal is for everyone to know the steps they can take to help reduce their risk of getting breast cancer and to recognise the signs and to give themselves the best chance of finding breast cancer early. All these steps combine to help reduce your overall risk of getting breast cancer and to find a breast cancer as early as possible.
Let's start with reducing your risk and look at the lifestyle. The National Cancer Strategy states that 30 to 40% of cancers might be preventable. Maintaining a healthy weight is crucial. This means eating a healthy diet that includes plenty of fruit, vegetables, whole grains, and fibers.
And hand in hand with diet is movement. Being physically active is essential for maintaining that healthy weight and keeping our body strong.
We also need to talk about alcohol as a risk factor for breast cancer. Alcohol is identified by the World Health Organization as a Class 1 cancer-causing substance, just like tobacco. There is no recommended safe level of alcohol use. Research shows alcohol is strongly linked with breast cancer, so limiting or trying to avoid it completely reduces your risk. There is also some evidence linking smoking to breast cancer risk.
For mothers, there's also another protective factor: breastfeeding. If you can breastfeed. The longer a woman breastfeeds over the course of her life, the more protection from breast cancer she builds up.
By following these steps, diet, activity, limiting alcohol, breastfeeding, and breast screening when eligible, you can actively reduce your risk of breast cancer.
It's really important to find breast cancer early for those people who develop it. This gives you the best chances of survival. You can increase your chance of finding breast cancer early by being breast aware and engaging with the Breast Check screening program when you're eligible. Not all breast cancers can be detected by self-checking or even mammograms.
Being breast aware means knowing the signs of breast cancer, knowing what is normal for your breast, recognizing if changes occur by doing regular self-checks and getting any changes or concerns checked by your GP. If you're between the ages of 50 and 69, you should also attend free breast check screenings every 2 years as part of your overall breast awareness. All these steps combine to help reduce your overall risk of breast cancer and to find a breast cancer as early as possible.
It's critically important that breasts are checked regularly. This regular checking is what we call being breast aware. It's a habit that needs to be built. It involves learning how our breasts look. It's recommended to check your breasts every 2 to 4 weeks.
By doing this, we will learn what's normal for each one of us. This makes it much easier to recognize any unusual or irregular changes if they happen. It is recommended to start checking your breasts from your late teens so that regular self-checking becomes a normal part of looking after your health.
Early diagnosis is vital. We should look for a new lump in either of our breasts or armpits, a change in shape or feel of one or both breasts or armpits, skin changes on your breast or an abscess like an infected boil in your breast, a change in the appearance of your nipple, blood-stained or water discharge from either of your nipples, a rash or eczema around the nipple area.
To help understand how to check properly, we have a video.
The earlier breast cancer is found, the easier it is to treat. Becoming breast aware can help you find cancer early. Being breast aware means knowing how your breasts normally look and feel. Once you know what is normal for you, you will be better able to spot changes that could be caused by cancer. There is no right or wrong way to check your breasts, but it is important to both look and feel for changes. Use a mirror when looking for changes in your breasts. Start with your arms by your sides and then move them up above your head. This can help make lumps or skin changes like puckering or dimpling more obvious. Look for a new lump in either of your breasts or armpits, changes in the shape or size of your breasts, skin changes like an area of red skin that is hot or tender to touch, or skin puckering or dimpling, which may look like an orange peel. Changes in the appearance of your nipple, like the nipple turning inwards, blood-stained or watery discharge from your nipple, a rash or eczema on or around your nipple. It's important to feel your breasts for lumps and bumps, and to feel up as far as your collarbones and into your armpits. Remember, finding cancer early makes it easier to treat, so be breast aware. Talk to your GP straight away if you notice any changes to your breasts, even if you've recently had a breast check screening test or are due for one soon. Don't be scared, don't delay, call your GP today.
We will share this link to this video with you for you to access it whenever you need.
Once again, it is crucial to get changes or concerns checked out immediately. When breast cancer is found at stage 1, the 5-year survival rate is incredibly high. It's actually 97%. These statistics come from the National Cancer Registry of Ireland 2023 report, highlighting why finding it early matters so much.
And remember, the breast check screening is an invaluable program for those eligible. For women aged 50 to 69 years, the breast check program invites patients for a screening every 2 years, completely free of charge. It is important to make sure breast check has your correct details so that appointments aren't missed. This can be done by calling free phone 1-800-45-45-55 or visiting breastcheck.ie.
However, anyone who has signs of breast cancer, regardless of their age, when they had their last breast check, or when their next breast check is due, needs to go to their GP as soon as possible. Don't wait for a screening invitation if you have symptoms.
If you notice a change, make an appointment with your GP as soon as possible. The GP will assess and can refer you to the nearest breast rapid access clinic. These are sometimes called symptomatic breast disease clinics. They aim to offer urgent appointments within 2 weeks of receiving the referral.
And for health service staff who've had a cancer diagnosis, remember there is the First Survivors by Survivors peer support service. It's designed specifically for HSE staff who've had a cancer diagnosis or are currently going through treatment. It offers listening, befriending and support from colleagues who've returned to work after their own diagnosis. They can also help by signposting to other helpful internal or external resources. You can contact the service by emailing hscstaff@mariekeating.ie or by calling 087 334 0235. So before we finish, let's take a look at this training model. It helps visualise what to feel for. There really is no right or wrong way to examine our breast tissue, but it's important to incorporate the entire breast, going as far as the collarbone, going over as far as underneath the armpit, and down as far as the first rib. And we can feel or palpate our breasts in a circular motion using our 3 fingers.
So it is important what to look for: hard lumps, soft lumps, lymph node changes in the armpit or neck. skin changes like dimpling or redness, bloodstain or watery discharge from either of the nipples, inverted nipple, and size and shape of the breast.
To close, let's recap our session. When promoting breast cancer awareness, start with prevention and how to reduce risks.
Secondly, look at early diagnosis. This includes knowing the signs, being breast aware, getting a GP assessment, and attending the cancer screening service for those eligible.
And finally, make sure you refer to the information and services available.
For prevention information, you can visit hse.ie/preventcancer. To learn about spotting symptoms, go to hse.ie/findcancerearly. For screening appointments and registers, use breastcheck.ie. For general health promotion, visit healthpromotion.ie/cancer. And for national statistics, visit ncri.ie. Thank you for watching. Feel free to watch this as many times as you need to, or send it on to your colleagues, friends, or family. If you have any feedback, please scan the QR code to complete our short survey. If you would like us to deliver an in-person breast cancer awareness training session for staff using the mannequin, please get in touch and email us at healthpromotion.wsapwicklow@hse.ie.